Hey guys, this is Dr. Cosby. I kind of wanted to take you through a dry run of how to do the homework assignment for the Pedro scale and the five articles that you will critically appraise using the Pedro scale. So what I have up here is the green article, which is the randomized control trial of passive accessory joint mobilizations on acute ankle inversion sprains. And so I wanted to just appraise this article because I actually haven't appraised it before. And so what you're going to do is basically you'll have your Pedro scale side by side, the research article that you are critically appraising. And you're just literally going to go down the list from 1 to 11 in order, although you'll find that as you start looking for certain criteria that they go out of order. So the first criteria is that eligibility criteria was specified within the research article. And so to meet that criteria, it means that the authors had a list of criteria and they list that criteria somewhere within the study. And usually you'll find that in the methods in the inclusion exclusion criteria. So I'm just going to go scroll down to the methods section. And so what we see right now is a randomized control trial was conducted in which the assessors were unaware of the subjects group assignment. And this was done obviously to create blinding, and then subjects were assigned to the control or experimental group. And so right now I'm not seeing what the inclusion exclusion criteria were so far, but then if I go to the right side of this article, what I see is it's beautiful. Inclusion criteria, exclusion criteria. So in this case, what I would say if I'm doing the homework assignment is yes, this particular research article did meet the criteria, and I'm going to strike through it, and that's going to basically be my yes for that particular article. The next question is subjects were randomly allocated to groups. And so in this case, yes, we know that, right? It's a randomized control trial. So obviously subjects and in this case, experimenters were blinded too, but a randomized control trial was conducted. And so you can see here, subjects were assigned to control an experimental group by use of a random number system. So that meets the criteria. And so again, I'm just going to highlight this yes, and then I'm going to strike through it as yes, they met the criteria. Now, as far as the where goes, what I would do is put the page number. So page 986, and then the same thing is going to apply here. It's going to be page 986. And so this is just one way to complete the homework assignment that you have due. And then so allocation was concealed. And basically what that means is that the person who determined if a subject was eligible for inclusion in the trial was unaware of their group assignment. And so again, that we hit that here, right? Group assignments. Subjects were assigned to control an experimental group by use of random number system. But then if we go back up, it says a randomized control trial was conducted with assessors who were unaware of the subjects. And then we would highlight this and we would say subjects group assignments, right? And so what that means is yes, the allocation was in fact concealed. So then we would check that off as a yes. The groups were similar at baseline. And so in order to determine whether or not the groups were similar at baseline, we would have to go to the results section where hopefully the authors state that. And so we'll have to take a look at whether or not they do. So as I go into the results section, there really isn't anything in this research article that makes me believe that they did or looked at the groups and whether or not they were equal at baseline. And so what I am going to do is I'm going to go back up to the actual treatment characteristics, and I'm going to look at the pre-mean for each group, and it appears that they were both equal, relatively equal at baseline in terms of dorsiflexion range of motion. However, I believe that this article did not meet this criteria because they did not report that there was a statistical analysis done to ensure that the groups were actually equal at baseline. So I'm going to put no. There was blinding of all subjects. Again, you're going to go back into the methods and you're going to determine whether or not the subjects were blinded to the treatment group. So as we look at blinding, it appears that the subjects were not blinded to the treatment. And that makes sense, right? Because if you're doing a joint mobilization or a manual therapy technique, subjects are going to know whether or not they received the treatment. And so there isn't any reference to the fact that the subjects were blinded to their actual treatment. And so in that case, again, we're going to click on the no for blinding of subjects. Okay, and then the next step would be there was blinding of all therapists who administered the therapy, and then the answer to that is absolutely, and you can see that here group assignment was concealed from all assessors, and so yes, it appears that the people delivering or the clinicians delivering the treatment were in fact blinded too. So I'm going to go here and I'm going to click a yes. There was blinding of all assessors, absolutely stated there as well, so that's going to be a yes as well. Measures of at least one key outcome. Well, there are several outcomes within this research study, but if we go back to the table, we have measures, pre-post measures for at least dorsiflexion range of motion for each treatment group. And so again, that gets a yes as well. All subjects for whom outcome measures were available received the treatment or control condition. And so, yes, and when you go into the results section of the study, what you're looking for is whether or not you had any dropouts, and whether or not they report that those dropouts within the actual either results or within the table itself. But it appears based on just reading that, in fact, most of the subjects completed and received the treatment. But then if we look here at the adherence section, this probably would give us a little bit more. All subjects in the control group returned their adherence diary. 3 subjects in the experimental group were failed to return to their activity diary. But this again has nothing to do with the actual whether or not the subjects made it through the study itself. And this is where a flow chart would be nice, so that you can see the number of patients who received the treatment, and if patients dropped out, the number that dropped out. And so this study doesn't do a really good job of laying out patient enrollment, but you can kind of assume, if you're looking at pre and post, that the number, as you can see, is kind of going down, and more down as we're looking at it. And so they're reporting the dropout rate, but you can see that at least in 85% of the patient, at least between weeks 1 and 3, there are outcome measures reported. So again, that would be a yes in terms of meeting the criteria. And then as we look down the Pedro scale, the results of between group statistical comparisons are reported for at least one key outcome. So the answer to that is yes, but we're going to look into the results section as well. And so we can look at characteristics of gait. Stride speed increased over the duration of the trial for both groups. Greater increases were found within the first and third treatment sessions in the experimental group, and they report a p-value, although I would say we're getting ready to go into effect sizes. I would also report an effect size as well. So the answer to this question, number 10, would also be yes, they meet the criteria. And then last but not least, this study provides both point measures and measures of variability. So they're giving you a mean, and they're also giving you a standard deviation. And again, they do that beautifully. In this case, they actually give you the mean, and they give you the standard error of the mean as opposed to the standard deviation, but they're giving you some sort of measure of variability. And then as we go through, if we're looking at other charts, you can see that they're reporting either the standard error of the mean or the standard deviation, which would be the longer points, right? So this would be, the center point would be the mean, and then the arrows coming off of it would represent either standard deviation and or standard error of the mean. So yes, absolutely, they provide both point measures as well as measures of variability. And so from here, once I'm done highlighting and checking through, remember, again, I didn't want to take a whole bunch of time here, but you want to add in the page numbers. Where are you finding the details of the particular study? You will find that most manuscripts now, at least the journal that I just submitted, they required me to actually critique or to use the Pedro scale on my own research article. And so I had to fill out where all of these criteria were met. And if I didn't meet them, I had to write in a justification for why I didn't do the things that were listed in the list of criteria. So this is actually, using the Pedro scale is actually becoming almost like what I would call as the gold standard for you as a researcher to use prior to turning in. Some journals will actually have you upload your Pedro scale assessment, and they'll go directly into your manuscript that you are submitting and confirm what you have written in your Pedro scale. And if you're missing something, then they just automatically reject it. And part of the reason that they're starting to use the Pedro scale and to have authors actually use the Pagel scale on their research manuscripts is because they really want high quality articles. Most journals will receive upwards of thousands of manuscripts being submitted, and so to cut down on the amount of reviewing that they have to do, they now are asking authors to do this. So I hope that this has been helpful. The total score on this particular Pedro scale would be, so what's this, 11 minus 2, so a 9. And so a 9 is a relatively high quality study. Some of these things, you know, the authors couldn't do anything about. So the blinding of the subjects, when you have an intervention or a treatment, it's very hard to blind the subjects to whether or not they're getting the treatment or the intervention. So most times intervention studies are almost always, not always, but more often than not, they're gonna receive a no on number 5. So I hope this was helpful. This is what my expectation would be for your homework assignment that you're getting ready to turn in. And so I've asked that you just put all 5 Pedro scale assessments in one Word document. And to do that, all you're going to do is literally copy, go down to a blank page in your Word document, and then just paste again and use it. And then up here, maybe you could put the title of the article and the authors of that article as well. And so that should be a 5-page document that you upload into the homework assignment. Please ask me if you have any questions or need clarification.